From Studio 3C in Rockefeller Center, this is News 4 New York.
In News for Your Health tonight, this is Melanoma Monday, a time for you to take stock of your skin's exposure to the sun. The question here, could you spot a melanoma on your body? Would you even know what to look for? And we're about to find out. Do not believe that old wives' tale that those with darker skin cannot get skin cancer. That could not be further from the truth. Dr. Khorasani is the Chief of Dermatologic Surgery at Mount Sinai Hospital and an Assistant Professor of Dermatology at the Icahn School of Medicine at Mount Sinai. And Damian Thompson is his melanoma patient. We welcome you, gentlemen, to News 4 at 7.
Thank you.
All right, Doctor.
Thank you. Nice to be here.
Great to have you. Now, Doctor, the Centers for Disease Control and Prevention says that melanoma is the most common cancer in the U.S., also the deadliest. Tell us kind of how it develops.
It's not the most common cancer, but it is, of all the skin cancer, is the most deadliest skin cancer. And the way it develops is usually from radiation. It's a mutation that occurs. Is usually you have to have a genetic predisposition and sun. It's those combination together that makes the cells mutate and grow uncontrollably.
Now, when you talk about genetic disposition, I'm very pale. I could see that playing into here. Damian, a lot of people might not think you'd have an issue.
Yeah.
But you did. Tell us your story.
I grew up in Jamaica. My grandfather is part Syrian, part white. And I mean, I didn't have it. I grew up, no one taught us about looking for certain things or to get your moles checked. Cause, you know, it was
wearing
just like,
sunblock.
Yeah, it just doesn't happen to you. You know, like, oh, that doesn't happen to you. You're fine, you know.
And what happened to you? Tell me. There you are enjoying the beach, having a good time, and that led to some trouble for you.
I broke out in hives from stress in October, and that led me to go to a dermatologist. And the two things weren't in correlation, but and I wasn't going to go, even though friends, you know, kept telling me for years, you should get that checked out. I'm like, no, you know, like I don't need to. No one, you know, no one ever gets it. Dark people don't get it. We're fine, blah blah. And then I went. The hives were fine. And then he.
And this is what you're talking about, just that little spot there.
Yeah, little small spot.
Looks like nothing.
Yeah.
To an untrained eye.
Yeah. And then I asked him to take a look at it. He looked at it. He took a biopsy of it. It came back a week later, and it was positive. Of course, I cried. Because it was like a shock. It was like, what? You know, like me. And he was shocked, you know. He was like, he's been working for like 80 years, and I think he said it was like the second black person he's ever seen to have it. So I had 3 days before I was going to South Africa, and I had to find a doctor. And my friends were all telling me, you know, check Mount Sinai. You know, they're very good. I had a friend that had previously had cancer, and she had went to Mount Sinai. And I went online, and I started checking, and I found Dr. Khorasani here. You know, he's also like a plastic surgeon as well, a certified plastic surgeon, so I wanted to look good after my surgery, so I was like, I'm going with this guy. Yeah, I'm going with this guy.
Take us through the treatment. What did you do here?
So what Damian had to do is called a wide excision, depending on the depth of melanoma, and that's what's so important. If you pick melanoma up early, like a thin melanoma, you just have a narrow margin, and you have a cure rate of over 97%. As the thickness goes deeper into the skin, the survival rate goes down significantly. And you know, today's Melanoma Monday, we really have to take the time to educate the public about how important a disease it is. This year we anticipate 10,000 deaths. As one American is dying from melanoma every hour.
So what should you be doing? You know, no matter your background, no matter what you look like.
Number one, check yourself. Majority of melanomas are picked up by patients or patients' family members. It's well known the fact that men who are married get usually picked up. The melanomas are much thinner than men who are not married. So have your spouse check your back, and ABCDs of melanoma is a good time to actually go and review them today. A stands for asymmetry, so draw a circle around your mole, and make sure that it's not asymmetric. One side of the circle matches the other side.
Gotcha.
Look at the borders. How are the borders asymmetric in way of, you have a jagged border? Is it irregular? Look at the color. Is one side of that circle you drew matches the other side? So uniform color is very important. Look at the diameter. Diameter is not the most important thing, but about most moles are bigger than a 6 centimeter or 6 millimeter are usually concerning. Most important thing to me is E, which is look and make sure that the mole is not evolving. Is it itching, bleeding? Is it growing suddenly? Those are the important things that you can look at yourself in the mirror and have your spouse look at you every month, or at least every few months.
Well, guys, I appreciate that background, that heads up. Damien, most importantly, glad that you are feeling well.
Yeah, thank you.
And thank you for sharing your story. You don't know how many people you might have just helped by doing so.
You know, and it was funny because there was one friend that helped me as well. My friend Amy was the one that kept telling me, you gotta go, and I was like, her voice was in my head. You know?
There you go. Well, thank Amy right now. Say
thank you, Amy.
You go.
Seriously, thank you so much.
And go and get checked.
And go, everybody get checked.
Once a year, go and get checked by your dermatologist.
All right, gentlemen, thank you for coming in.
Including you.
Appreciate it. Yes, absolutely, absolutely.
Thanks.
Thanks, David.
Pleasure.